Hi, I'm Dr. Ed Beyer. I'm a chiropractic physician in Tinley Park, Illinois. Today I want to talk to you about a digestive problem that if you're suffering from bloating, especially after you eat, or constipation or diarrhea or a combination of the both, you have a better than 50% chance of having what I'm going to explain to you today. And that's called small intestinal bacterial overgrowth, or SIBO. You can Google it and look it up. There's a lot of information on this. What it is, it's you have too much bacteria in your small intestine. And the main causes of that are poor stomach acids. Our stomach is meant to be very acidic. In fact, acid reflux is usually due to low stomach acids. We're going to cover that another day. And if you have poor stomach acids, you're going to have bacterial overgrowth in your small intestine. Another cause of too much bacteria in your small intestine is the connection between your brain and your gut, which is called the vagus nerve, is poor. And we're going to cover that on another day too. But those are the number two reasons. Another reason for bacterial overgrowth is taking proton pump inhibitors or acid reducers like Nexium and Prilosec and omeprazole. And we're going to cover that on another day too. But there's many reasons, we covered the main ones, why bacteria will overgrow in the small intestine. You don't want a lot of bacteria in your small intestine. You want it in your large intestine. And when this happens, then we will eat certain things like sugars, which also include artificial sweeteners, and high fructose corn syrup, which is the number one added ingredient in foods in the United States. Galactans, which are things like peas and lentils and beans. Fructans, which are like in cruciferous vegetables, cauliflower and broccoli, onions and things like that. And starches like potatoes or grains like wheat and rice and quinoa and all that. When you eat these foods and you have too much bacteria in your small intestine, if it's overgrowing, then you're going to have fermentation of these foods. And this fermentation will cause gas formation, and that gas will either be methane gas or hydrogen gas. You're going to produce too much of this, and some of you know that you're producing too much gas already. Now, if you produce too much methane gas, that's going to lead to constipation. If you produce too much hydrogen gas, that's going to lead to diarrhea. Some of our patients produce both forms, and they have this alternating dilemma. Some days they're constipated, some days they have diarrhea. You go to your doctor, and they say you got irritable bowel syndrome, which is basically your doctor's way of saying they don't know what's going on, okay? This is so common in the United States. We see it in about 75% of our patients. The way that we diagnose it is we do a breath test, which will measure these gases, and we'll see which one is predominant. Then we go about identifying the underlying causes to this bacterial overgrowth in the small intestine, and then the patient gets better. Folks, I hope you have a great day. I'm Dr. Ed Beyer. Talk to you later.